to Future of Our People, our podcast series. It's a series dedicated to leaders who are shaping the future of work. Today, I'm delighted to welcome Mr. Chandrasekhar, who is the founder and CEO of Forus Health. Mr. Chandrasekhar brings over 2 decades of rich experience in the semiconductor industry to the healthcare sector, blending technological expertise with a profound commitment to social impact. Mr. Chandrasekhar, great to have you today.
Thank you. Thanks for having me.
Brilliant. Thank you. Let's jump in, Chandrasekhar. Since its inception in 2010, Forus Health has been a pioneer in leveraging technology to eradicate preventable blindness, right? With a commanding presence that includes 7 innovative products operating in 60 plus countries and impacting more than 50 million lives. I would love to understand your journey, how you come from kind of a rich corporate background working in semiconductor industry more than 20 years to founding Forus Health, and what drove your passion towards combating preventable blindness?
Yeah. So I think a lot of people will be under the assumption that some of my family members or somebody close to me lost vision. So that obviously inspired me to get into this. But the truth is, I was primarily working in the semiconductor electronic space for more than 20 years.
Yeah.
And my last job was with Philips or NXP Semiconductors, and I was the director of strategy. And I think in 2005, we had the, Philips set up some of the innovations. They wanted to look at how to innovate for emerging markets like India. And they wanted to come up with new products as a Philips brand. And in this process, they wanted to put a team which will look at new products. When they were doing, I was part of that. And when they were doing that, they actually gotten people who have innovated in different spaces, completely not relevant to where Philips was, but just to basically inspire, motivate. And one of them was Dr. Arvind from Arvind Eye Care, Madurai. Okay. And he came and spoke about how Arvind as an organization has taken this cause of avoidable blindness. Okay. And implemented that, and the kind of emotional and social and economical trauma somebody goes through when they go blind. So basically, one of the critical points, there is a very beautiful video about Arvind in YouTube. You can go and watch it, called Infinite Vision. It's also available as a book. And it is about how when somebody becomes blind, and they have a very, very beautiful phrase in that video, which says, a blind man is a mouth without hands. So he becomes a liability, both financially and economically and emotionally, to the family member. So this was something which was a little striking. And if you really look at the working class people, the people who have, started working from, let's say, 5 or 10 years, doing work till 60 or 70. And they basically have to, probably have a very graceful death, enjoying their lives with their grandchildren. But unfortunately, the fact that they can go blind and they are neglected primarily because the children or grandchildren are also working on their daily wages, right? So they can't babysit them. So this fundamentally becomes a problem, and people who would have probably lived another 10 years probably die in 3 years because they feel neglected. And so this was fundamentally the emotional part of what kind of we looked at and felt, oh my God, this is something which we never knew. And we obviously want these people to have a very graceful and happy life after having, worked for 50, 60 years. So that was the starting point, which actually kind of gave me an idea to start looking at this space. Okay, so again, with no expectations or no understanding. And then could go to Arvind Eye Care, Madurai quite regularly during weekends. So like go on a Friday night and spend the whole of Saturday, sometimes Sunday, just to understand why this is a problem and how big is this problem. So one is, of course, hearing that. So that gave us a lot of data points. So, for example, India has the largest blind population in the world. 80% of that could have been avoided if they were screened on treated on time. India has only 20,000 ophthalmologists for, let's say, a 1.3, 1.4 billion.
Avoid it, sir, just for my own knowledge. When
So basically, the thing is, again, 20 years back, there were two major problems which contributed to avoidable blindness. One was cataract, and
okay.
the one was uncorrected refractive error. So a cataract could have been, you could have avoided by a simple surgery. And second is the uncorrected refractive errors you could have solved by actually wearing a pair of spectacles. Now, because the number of ophthalmologists for a 1.4 billion or 1.3 billion population is only 20,000, the access and affordability of reaching an ophthalmologist, and more importantly, the awareness that you are having an eye problem was not there in the community. So that is why people were going late, and either it was too late or it was irreparable. So we took access to all these data points and wanted to see, okay, if we have to complement an organization. So Arvind kind of an organization was making some phenomenal innovations to reach out to people where, the Arvind model is quite famous. So they were having these MLOP concepts who are doing a lot of things so that the surgeons can do as many number of surgeries possible. So they had innovated a lot on the operational side, the treatment side, and that model is also being followed by a lot of hospitals. Some of the hospitals, Shankar Nethralaya, LV Prasad, they have come up with their own models, and they have also made a huge impact. But that is on the treatment side. But as in the last 10, 20 years and going forward in the next 20, 30 years, we are going to have a lot of chronic diseases. We are going to have people with diabetic retinopathy, with glaucoma, macular degeneration. And unlike cataract and refractive errors, which are very symptomatic, you will start to know that there is a problem. You may not know whether it's cataract or something, but you will know that there is reasonably what you were able to see before, you're not able to see now. Whereas these problems like retinopathy and glaucoma are very non-symptomatic, and it can even happen to a lot of educated people, right? And now with you using your phones and screens, a lot of people, kids, 1 out of 2 kids are going to wear a pair of spectacles by 2040. Every second kid will wear a spectacle. So, and given that the number of ophthalmologists again doesn't dramatically increase. So it's been hovering around the same 20, 21,000. So, and this is a global phenomenon. So even in the US, there are hardly like 23 or 24K ophthalmologists. So basically felt that we have to do a tech innovation to complement organizations like Arvind and Shankar Nethralaya and LV Prasad so that they can do the last mile treatment. We should diagnose and screen people at their doorstep, or when I say their doorstep, closer to their doorstep, so that they know that they have a problem, at least at the diagnosis level, and then they can go to the respective hospitals for treatment. Of course, affordability comes in, and now people who can afford can go to private institutions. People who can't afford can go to government institutions or charity institutions. So that is, that's going to be a continuous evolving process. But the fact is that if you can create an environment to screen people early, so that they connect to the treatment and connect them to the treatment ecosystem, then you are playing a role in this avoidable blindness. Anyway, the good part of is this, the treatment ecosystem has reasonably well evolved. They are making tremendous innovations so that they can use a surgeon to the maximum to do as many number of surgeries as possible so that the population, if there is more demand, they can meet. So that, if you really look at it, it is for the population which actually knows they have a problem and have reached. But there is a large population who don't know they have a problem and don't have, access. And they would again be burdening the same ecosystem for diagnosis. So we thought that, okay, if we can create an intermediate ecosystem for diagnosis, that could be very eventually used. So the idea is, the principle is the same as Arvind, like eradicating avoidable blindness, which is the mission of Arvind also. But ours was using technology, which is not the treatment side. So when I say we have to do technology, then we have to understand what is the what is that which is required, right?
Mm.
So we analyzed a lot of things and we found that there were equipments which were needed, and if these equipment can fulfill like 3, 4, 5 criterias, uh, see, the equipments were available. They were state-of-the-art equipment made by some of the best names in the world were available, but they were all meant for a eye doctor, specialized eye doctor. They were expensive. They required dilation of the eye. They were not very portable. They were meant to sit in a hospital.
Innovation
So
in
our idea was that those equipments were anyway taking care of people who are coming to a hospital.
yeah.
Can we develop equipment which will be useful where you can screen at any location? So kind of democratizing eye screening. So you
Mm.
screen people early and then connect them to the Arvinds and the LV Prasads of the world for treatment. Then you are playing a role in the avoidable blindness space, and you are actually doing the first cut where you are kind of screening and connecting them. So you are ensuring that more and more people get access to a first level diagnosis. So that was the fundamental principle. So I want to reiterate that we did not want to build a medical devices company.
Mm.
Medical device was a consequence. We wanted to work on avoidable blindness. That is a mission. And
But
then
that,
the first step was, this was the gap. Okay, so the gap is what we try to fill. Of course, once you decide that this is the way you go, then you also have to build a company, right? It is not, mission is fine, all this is fine. But you talked about, we today have close to 200 employees. So if you have to bring in employees, we have to have the best of people. They all have to have a good environment, be taken care from all the resources perspective. So we need to build a sustainable and scalable business.
mm.
So this has to be viable as a business. At the same time, it has to be affordable, right? And it has to create a different level of create a different segment where we are going and doing. We are not deviating from that the impact what we wanted to create. So it's like walking on all of that. So how do you use tech? So that is why today, when I look back, we are not just a medical devices company. We are a company which make medical devices. We have a platform so that these platforms can be deployed anywhere. We have an artificial intelligence, which is ultimately used for first level triaging. And then we also do the last mile screening using our own team, go to corporates or go to home, screen people, and whomever we find a problem, connect them to the hospital. So this entire suite of things we had to do. And in that, obviously, we had to look at what are the large problems which are contributing to avoidable blindness. So we looked at adult space, which is cataract, retinopathy, glaucoma, taking the image of the eye. Second is the neonatal side, which is newborn, premature babies. And the third is refraction, which is basically giving you a pair of spectacles. So we evolved that space, and then we came up with a specification that, okay, if it has to work in a community kind of an environment, it has to be affordable, it has to be rugged, it has to be portable, it has to be used by somebody who's very, very minimally trained. It has to be without dilating the eye. It has to take an image without dilation. So we started off with that basic spec. So we are not reverse engineering existing products or something. So we started off with the basic spec. This is what I want.
Mm.
How should I design the product? What should it have? What should be the, so that is how we evolved as an organization. So it's a slightly different, but I think because the purpose was fairly clear, we've had to work towards the purpose. But again, even though the purpose was to do this, the channel of implementation also is very important. So ultimately, you are making a device which is um, imaging the eye, right? So which means the people who will appreciate your product are going to be ophthalmologists. So when you still create a product with these specifications, ultimately the quality of the image or the product has to be appreciated by the ophthalmologist. It's not a community product. It is a product which is acceptable in the mainstream. So today, all the major eye hospitals in India and even in the world use our devices. So which means that is a credibility building. So once you build credibility by Arvind's and LV Prasad's and Shankar Netralia's buying your device, Agarwal's buying your device, that builds credibility to the product. So when you take it that now to the community also, when I think community, ultimately it could be primary care, it could be endocrinology, it could be anywhere. The community starts to believe, yes, this is the same device which is being used in the big hospitals. That is the same device which is being used here. So one is having a mission statement. Once you have the mission statement, look at what is the gap, what is required. And then after you have identified that, do away with all this and then look at how do I build a sustainable business around it. And then once you've built a model, then again go back to see, is it deviating from the fundamental mission which you started with? Because at the end of the day, if you do all this and then it is violating what you started off with, then there is no sense. So this is how we have kind of evolved. Of course, this has been a long journey. It's not happened.
I would say this is pretty impressive. It's a journey, and it started with one thought, right? It's one thought kind of now that thought kind of impacted 15 million plus people globally. Yeah. And if I read it right, Mr. Chandrasekhar, now you wanted to become a digital platform company so you can scale, and you wanted to bring in artificial intelligence technology to reach more people, right? You wanted to democratize. And that's pretty impressive. On that note, I just wanted to understand, Mr. Chandrasekhar, around the role of artificial intelligence, right? In terms of how is that impacting your industry, and how you as a company adapting these artificial intelligence technologies, whilst with the help of these technologies, your reach becomes far more wider and faster as well, right? I wanted to understand your take around that.
Yeah, see, I think even 14 years back when we started, that time the word artificial intelligence did not exist. But we basically had a concept, what we call as decision support system, ESS. So what our original thought process was that, okay, we will make a device. That device will connect to a cloud. And cloud also was not very popular that time, but we're basically saying we will connect to internet, which will do remote diagnosis. And then in that, we will kind of triage what we think is a normal image versus what is abnormal. So this was original idea 14 years back, right? Those days, none of these concepts were available, but we continue to work on this because we knew at some point of time they will become very, very relevant. So that is one. Second is, again, artificial intelligence is becoming mainstream, but it also has been overhyped because that it is going to solve all the problems. I think not. I think we'll have to be very realistic, practical in terms of acceptance, right? See, how good or how bad is actually not a discussion. I think the discussion is going to be how acceptable it is going to be. What is going to be people who are going to accept? What are doctors going to accept? Because everything, we haven't seen the whole spectrum of things, right? So for example, if I screen somebody in India, in Bihar, I screen somebody in Andhra Pradesh, I screen somebody in Tamil Nadu, there will be a lot of minor differences in the way they have a problem, because the constitution, and the same thing if you do with, let's say, a Caucasian eye or people in Africa, there is a significant difference, or there is a reasonable difference between how these eyes are constructed depending on the region. So it is not that it is a absolute foolproof system, but I think it is a system which is learning, and you should use it very appropriately on the low-hanging fruits first. Get confidence so that we start implementing this. And it is, again, a lot of people came up with concepts, not just in ophthalmology, but also everywhere, that, AI will replace doctors. I think that is not at all true. I think doctors have the role which only they can do. AI is only going to assist them. right?
Mm.
The assistance is going to be primarily on areas which is fundamentally mundane, which, we can save a lot of time of the doctor.
Mm.
So I think the understanding and positioning has to be very, very important, which is what I think sometimes we overdo certain things and the real use of that gets lost. And for us to come back and rewind and do it takes a little more time. If you look at very simple ways in our space, I think AI getting US FDA approved, 2, 3 companies already got it in the US. So one of the early areas where disease diagnosis through AI autonomously was accepted. In our case, I think we have huge repository of images which we have ethically stored, which we have used for building this AI. And we are very cautious about implementing this because it is not just about the hype saying, oh, I have AI system. I think it is what is very relevant is how do we bring in confidence both to the users as well as to the ophthalmologists that it is helping them, it is solving some of the problems, and it is reasonably getting better and better. So I think that is the journey. This is also a journey, right? So simple thing is, for example, when you are saying a minimally trained technician will take an image, that technician need not know what is a good retinal image. Is it good enough for the ophthalmologist to diagnose or not? There, you can actually use AI to tell you, okay, the image what you have taken is good enough for the doctor to grade. So it's good enough. Now, so let's say I'm a patient. I've come and sat in front of a machine and then I have taken a picture. Now, because the technician doesn't know anything, he's just sending it to the doctor, and the doctor, after 2 hours, says that, oh, this image is not good enough. Now, the patient is already gone, right? He's not sitting in front of you, he's already gone. So, in those kind of cases, it's a very low hanging fruit where the AI can intimate then and there that, okay, this image is gradable or not, so that the operator can take another picture if the AI says it's not gradable. So, thereby, you are improving the productivity, ensuring that whichever patient came, you took. So that's the low hanging, easy adoption.
Quick question. What is how you as a Forus Health leveraging AI technology, right, in your own mission and purpose to scale your business, to reach out to more audience? I'm more interested in terms of your aspirations, or where are you and how are you going to leverage the technology, and what are the skill sets that are required within your company, right? Is it something, could you share?
Sure. No, I think the AI is going to become way of life going forward, whether it is at a community level screening where you are triaging images using first level diagnosis, and only images which have been triaged as abnormal go to the ophthalmologist. So you are reducing the the load on the ophthalmologist. This could be the first thing. The second thing could be a lot of productivity improvements. The one which I told you was productivity. It could also be, used in optometry where, because you're online, I can take your face, I can look at your contours of your face. I can suggest you which spectacle looks good on you. I can do all the measurements for you so that you don't physically visit an optical store. And I still send you a good prescription, which you can use, a good spectacle, which you can use. So that could be the second productivity improvement. The third, which I think is very important, which we are also working and we made reasonable progress, is, ultimately when we are deploying this in primary care, which is where we can have lot more early detections of eye problems. Eye is considered a biomarker for it's a window to your body, right? So, and there have been lots of research over the last 30 years people have done to see, okay, if using your retina or looking at your retina, can I diagnose that you have early symptoms of some of the problems? Could be cardiovascular, it could be neurological, it could be nephrological, autoimmune diseases, Alzheimer's. So we have been also working on these algorithms. So wherein we can, not only identify the eye-related problems, but we can also kind of give an early warning signal to the primary care physician that compared to the normative data which we have seen, this person's looks slightly off. So then, because he's in primary care, the doctor can actually ask him to do extra tests. Could be, if it's, let's say, cardiovascular, he may ask him to do additional tests to ensure that he's not carrying a cardiovascular risk. Because this is non-invasive and it is, undilated imaging, and comes at a low price point, this could serve as also an extremely good triaging system so that you don't, as an individual, don't go under the knife sometimes because you've been warned early. So these are, I think, some of the use cases, right, which is really required, which will help AI to transform the way. So diagnosis of these standard eye problems, which is very common, retinopathy, glaucoma. This is again
This
based
is
on
something you're working on, that, right, sir?
we already have.
On that note, Mr. Chandrasekhar, because you've been growing very organically, right, over the last 10 years or 15 years since you've started, what kind of skills that are required for you? Because you being an innovative company, right, you always look at certain gaps and you always have that purpose in terms of how do you kind of create a bit more impact to the people's lives. So what kind of skills that you would foresee required in your industry so that it's motivating, or even for people who are looking to embark their journey in the healthcare industry, right? What kind of skill sets do you think you recommend that are required? And you as a CEO, what kind of skill sets that you would look for before you employ a person?
See, I think, whatever Forus is today, it's not about the mission or the idea of what we carried. I think it is because of the hard work of people who have made this dream come true. So it's only because of that. Otherwise, it would have still remained a dream, right? So I think this is a full-fledged journey, right? It is not making devices. It is not just selling devices. It is also reaching the last mile and ensuring. See, the purpose, one thing which we continuously keep talking about is that, you make a product, the product identifies a problem. Okay. I can make a very blunt statement, so what, right? So unless that individual who has been identified with a problem goes for treatment and gets, his problem solved, we have still not solved avoidable blindness, right? You may have stung on a business. So we have to continuously think, how do I, till today, we have been working lots on how do I reach the last mile. We also have to continuously work on how do I motivate this individual who has been identified with a problem to go for treatment, right? In the sense that if it's purely economical, I don't have the ability to fund him. But behaviorally, how do I motivate him to go and get himself treated? Only then this whole purpose is kind of taken care. Now, in order to, if I take this as the purpose, there are at least 3-4 buckets which the company needs to have. One is building innovative products, which is the R&D part of the company. Then the company which creates that products and delivers this, product after product. So today we have like 3,600 plus installations globally. You have to cross regulatory clearances, FDA and CE and India and Japan and all that. So the manufacturing arm, which becomes very, very critical. So it's a second. The third is, okay, you made a good product, you have manufactured it. You have to reach to the ophthalmologist, right? So you need a strong sales and service team so that the product reaches the doctors and you also give extremely good service. And the fourth is we also talked about the last mile where we want to screen. So that's where we created a solution team, which combines our hardware and software and delivers the screening at the doorstep of the customer. It could be at corporate level or at home level. So these 4 big buckets are, our competencies as a company. And of course, supported by finance and HR and all that, which is obviously required, and management. Now, if you look at purely on the R&D side, now you need strong optical knowledge, you need strong electronics knowledge, you need strong embedded knowledge. Then you have cloud, because you'll have most of the applications you have to create. When you get more and more consumerized, you need to have the cloud and the application building capabilities. Then obviously the AI part, which we talked about. So all these constitute the competencies which is required, and some of them are really high competencies, right? So where you need to build products which is accepted globally, you need to have competencies which are at that level. So you need extremely good R&D innovation capability, and we also have to look at what is the gap. So 4 or 5 years back, or even 7, 8 years back, we were talking innovation means creating something fully innovative, one full system. But today, when I get closer and closer to the customer, even small innovations, which are actually the blocks, which is not allowing me to connect to the end consumer for whatever reasons, those innovations also become relevant because your mission is to reach the last mile. So small innovations, these big innovations connected by small innovations where we reach the people become very relevant. So this is the first. The second one is the manufacturing. So you have to build world class products from India. Today, when we're exporting, making a medical devices in India has not been one of the sunshine industries, but now I think there is a lot of focus from the government. A lot of people are wanting. So creating a ground up medical devices company in India becomes very important, for which you need to build a world class manufacturing capability and a manufacturing team which is capable of delivering this to global standards. Having that we are building for the world. We are not doing something. So everything. So right from the value engineering, how you do the cost of the product has to be kept low, but at the same time high quality. The process consistently has to be maintained. You have to pass all the regulatory clearances for different countries. You have to have traceability of your if there is a failure. How do you do failure analysis? How do you do post market surveillance? Everything becomes very critical. So the medical manufacturing becomes a very important part. The third, the sales and service network, which is you need quality people who are the front ending that, taking these products to the hospitals and doctors, and also providing extremely good after sales service in installations and service and all that. And then ultimately the last mile, which we talked about, where we're delivering care to the consumer. Okay, it may be through a corporate, it may be through direct. How do we provide this service? How do we ensure that the customer is happy? He becomes a repeat. You also manage his disease if he's got a chronic disease. When I say manage, I'm saying facilitating the connection between the hospital and him, in terms of how do you do that and consistently. So this is a R&D manufacturing. These are one things where you have a timeline, you develop and you build and you deliver. Different mindset. But when you're delivering solutions on a daily basis, your quality of service has to be exemplary every day, every customer. Very different mindset. So you have to have these combinations to make this whole thing work. Okay. So different skill set, different competencies, but then when you join all of them, it has to actually deliver the purpose what the company has been created for.
This is pretty amazing, Mr. Chandrasekhar, and I think let's get deep dive in terms of leadership and culture and employees, right? Because that's one of the key areas. Once you have built up a system, once you've built up a company, right? It's very important to maintain that culture. Like how you as a leader cultivated a company culture at Forus Health that aligns with your missions and values, right? And what role does your culture play in your strategy and operations?
No, I think, see, we very clearly discuss the quality of people whom we need to make this dream come to reality is exemplary. Okay. And these exemplary people are there in today's market. Obviously, there are going to be companies where they will be offered substantially higher salaries at fancy locations, and for a small company like us, it's very difficult to match, right? So the only way which keeps people bonded is the mission, right? And a lot of people who have been with us, and I'm very happy to say that out of the 180 odd, we grew a little well in the last few years. But the core team, whether it is in R&D or in manufacturing or in sales and service, they have almost, I would say, like almost 30-40 of them are for the last 9-10 years. They've been with us. And these are the core people. Like we never had any of the core people out. The other important thing is we have almost close to 30% of our employees are females. So we also have very, that's what I hear, that very open culture which helps them. sometimes so happy to see somebody joins us from college, marries, gets the first kid, gets the second kid, and still continue to be that. So the company has been with that, and we're not, a huge brand, right? But the fact that, and the other motivating factor I feel is for the people is that when you work for large companies, you're doing a subsystem, you're doing a code, you're doing something. You don't see the bigger product or picture. Whereas here, you create a product, it takes maybe a couple of years, then it goes to the market, and you go and see it for yourself, the impact it is creating, how it is touching lives. You see it yourself, you experience it. I think that also drives a lot of self-satisfaction, matter of pride for people, and people kind of love that. There are a lot of people who want to do good, and they want to use their capabilities and competencies to this country and want to help people. So I think that, see, again, very important, I feel, is when you really walk the talk. See, it's very easy for you to make very flowery statements, but underneath don't do that, right? But when people within the company who have been experiencing, they all know that actually, are we walking the talk? Are we really doing it? And it is very easy to kind of, for an outsider, it could look nice, but inside, unless people really see that, okay, the company is still exactly doing what they're talking about, that realignment continuously or ensuring that again and again and again, I think has kind of worked. The other important thing I also feel is not restricting. I think while the mission is intact, no deviation from the mission, but you also have to figure out how do I leverage or monetize it far more better or scale this far more better than what we are, so that it also benefits monetarily. So its impact, all this is good. But at the end of the day, I also have to be monetarily assisted. So for which we have to build a sustainable as well as a scalable company. So you need to kind of have a balance of all of that. But the sense, I would say the most important thing is people know that we are creating something for our country, which is taken to the world. And I'm seeing the impact myself. I think that has been a big trigger point, right?
So you would say the purpose, right? The purpose is bringing them together, and they see the bigger, and when they see the results, it's kind of keep.
I think this is a purpose, right? Has a significant impact. So people, it's not like the innovations or products have come from me or some senior leaders. It's all come from everybody, right? They have contributed. They have come up with new ideas, and the exposure to the hospitals, to the patients, and the patients who have impacted, patients who have got their eyes saved, adds a lot of personal, if you want to call it, positive karma to you, right? So that I think a lot of, and
so it's very clear, right, Chandrasekhar, is you have a strong purpose driven that is bonding the people, and second is you also have a diverse culture as well, right? You've got, as you represented, most of your employees are women representation. That diversity also brings, and it also, you talked about open culture as well, where people have that
on very cutting edge stuff, right? It's not like we're doing Me Too stuff. So one is keeping their technical, I'm working on the next generation stuff, that keeping intellectually connected, then getting them purposely connected, and then providing the environment where they're wanted, or they are continuously being encouraged. I think that combination, and obviously it's not me, right? It's entire management team which has made this possible, right? So it's about everybody, kind of in their own styles. Different people have different styles, but I think ultimately the purpose or the overall concept, what we're talking about, is practiced by most of us. So that is where we continue to kind of grow. And most of, as I told you, like most of our core members have been there with us for more than 8-10 years.
And I think that's a very interesting point as well, right? You mentioned, in fact, there's a very good data point, Chandrasekhar, right? If you look at Gallup, which is one of the people survey company, right? In India, we have 33% of the people who are highly engaged. when we talk about engaged, are the ones who are really, really connected, emotionally connected to your company, who brings that innovation and performance and take your organization forward, right? Where rest of the people are disengaged because the employee expectations are shifting, right? Those were the days where we are very loyal to the company for a long, long time. But now, in fact, 60%, 67, there is a data point where 67% of employees now they look to work for a company that has a purpose. It's a purpose driven, right? So on that note, I just wanted to understand in terms of employee engagement, what strategies or what has worked within Forus Health to ensure that your employees are actively engaged and they bring authentic and best version of themselves, because you being an innovative led company, the innovation has to come from the team, right? So is there any particular strategies that has worked for you that you could share with us?
No, see, when we were a small company, the interactions with everybody, irrespective of which division or was almost there on a daily basis. So we talk, we do. So I think the engagement at that level was extremely high. Then we actually had the manufacturing team in a different place and the R&D team in a different place. And while there was a lot of engagement within the group, we still felt that it may be much better off. And obviously, you need resources and time to come there. So today, very recently, maybe about 4 or 5 months back, we kind of moved to a new location where we have a single integrated organization where we have the R&D and the manufacturing and sales and service and everything in a single building. We share the common lunch space and we chat and we walk down ground first or second, or so that also brings in a lot of engagement, very close within the company. We have also consistently, if you look at our messaging within the company and outside the company, we have always messaged primarily around the mission statement, in the sense that, okay, this is the impact, what we have done, this is the change we have done, this is what, how many people have got identified with the problem. And then a lot of people are consistently involved, in the sense that even though the implementations team could be the sales or the solution team, which actually goes and does, we always involve somebody from manufacturing, somebody from R&D, to be part of each of these events. So they also, they get a first time access. So two things. One, the purpose is they get access, they know what's going on, how it is impacting. The second is also they see some shortcomings. So for example, just as an example, right? So if I ask as an implementer, I ask for a feature, the software guy may ask, oh, why do you need it? But when you actually have him as part of the team which is implementing, he himself is going to go and make the difference. He'll say, okay, I saw this bottleneck, this process was taking a couple of minutes more. If I could have modified my software, this could have, speeded up the whole thing. So that level of engagement, when you bring in, it becomes always good. And the other important thing is we always keep this very open. So we don't have too many, so we interact, we take ideas. It's not that every idea is correct or every idea is worked, but we are very open. We don't fear about failure. That's also has also been one of the reasons while we allow people to fail first time and learn from that failure second time, so that that's the same thing is not repeated. So I think that also has helped us as a company, like try it out, works. So I think that that sense of bonding, I think we should continue to engage, and probably this new environment gives us more engaging time where we continuously talk about purpose, continuously talk about, and a lot of things which we're aligning towards the ultimate goal, the new things. I talked to you about these smaller innovations. When we integrate these smaller innovations and the purpose is met much more higher than what we are meeting today, I think the understanding of that also becomes far more better. So it's deeply imbibed. So if I do my role well, it's solving the larger purpose. If that is a communication which we continuously kind of keep giving. So it's not like, okay, I've done my job and what others do doesn't matter. It's like I may do my job. I should do mine very well. May also have to assist somebody who's doing something different. But because ultimately, even one of that in this chain breaks, we don't ultimately reach the purpose. So I think communicating that and learning from each other always has helped.
I mean, these are important, right? Thank you, by the way, Chandrasekhar. It's all about the last point. What you mentioned about is having that mindset shift from me to we and connecting them to a common purpose, right? When they see the bigger picture, and that's where everybody is aligned to one committed common goal. Take the business forward and take the organization forward. And also, I personally talk about bringing that compassion in the leadership style and compassion in the organization, right? Where you bring your care and wisdom and connect people, engage employees, and lift the heart and spirits of the people. But these are brilliant insights, Chandrasekhar. Finally, is there any wisdom that you would like to share to entrepreneurs or even employees who wanted to work for Forus Healthcare? What wisdom would you like to share for them?
I think whatever we have learned, I think is the only one simple thing. I think the deeper you know about the problem statement you're trying to solve,
yeah,
the chances of you succeeding is high. It may be slow, it may be delayed, but it is guaranteed, right?
yeah,
that is completely how deeply you know the problem statement, right? And the problem statement in our case was avoidable blindness. Simple, but it's a very easy motherhood statement, right? I want to work on avoidable blindness. But then if you break it into compartments and get deeper and deeper into each of them, why it is happening. So if you work on the general purpose, you become an NGO or a charity organization. When you take this statement and break it and build an organization, which is for-profit organization, then you build a company. So I think for entrepreneurs who are building companies, I think it's very important to understand your problem statement, whatever you're trying to solve, very deep.
yeah.
Be it behaviorally, because a lot of times we miss the behavioral part of how this business or this whole thing is being conducted. You have to get, because end goal is somebody is going to use it. How he's going to what behaviorally is going to be his attitude towards this solution. So
Yeah.
you have to build all of that. And of course, the other things are given, like the product has to be good, it has to be technical, it has to be like value for money. All that I think everybody does, right? It's all a given, and if without that, none of this will work. But I think those are a lot of people have expertise in telling that. But I think my personal take on this is the more you understand your problem statement, whatever you're working on from all angles, I think the chances of success is very high. It could be delayed depending on the industry you are in, because on the ecosystem you are in, but it will be guaranteed. So also, I think the other important thing is all of these things are. It's not like Forus comes and tomorrow everything gets solved, right? It is not. It is not the situation. The patients have to cooperate. The doctors have to be there to treat them. Other interventions have to be available. All of these. So it's an ecosystem. The ecosystem also starts to mature when the solutions become viable. So you should allow the ecosystem to also develop and mature along with you. If you try to fast track it, you will also break. So I think you'll have to play a very, very level-headed way of scaling. And there will be a time when it'll kind of scale up, because people have seen the success, they'll see, and then it'll scale off. And you must have the patience and persistence to pursue with your problem statement or your mission statement till that time.
These are brilliant. I really love the last one: patience and persistence, and lead with purpose. Right. This is pretty brilliant, Chandrasekhar. I think thank you very much for your time today, and for anyone who wanted to get into entrepreneurial mindset and your insights, especially in the medical healthcare sector. Right, in terms of you given a kind of blueprint how you approached your own company and how you took your business for growth organically as well, right? It's a very consistent organic growth that you've achieved. And most importantly, you're impacting people's lives. I mean, 15 million people is no easy feat. and how you now adapting artificial intelligence technologies and being a tech-led, you have more and more impact now to create and reach to wider audiences, right?
Absolutely.
And thank you. And I really wish you all the best, Chandrasekhar. And we really appreciate for your time today. And thank you very much.
Thank you. Thank you for having me, and good wishes to everyone.
Thank you.